Good morning. I'd like to call the meeting to order. The first order of business is to review and approve the minutes from the November 22nd, 2019 Board of Health meeting. Has the board had a chance to review the meeting minutes?
Motion to approve.
A second.
All in favor signify by saying aye.
Aye.
Aye, so approved. The next item is to review and discuss a request for the town of Shrewsbury to notify pregnant women about the latest study on fluoride's link to reduced IQ in children. Has the board had a chance to review the additional materials
Yes.
sent by Mr. Moss?
Yes.
Yes. As well as a couple of other studies that are out there. I think there's another one from Mexico that was done that actually had the same findings as the one from Canada.
Okay. Well, I guess in order to start off the discussion, I have gone through all the materials, and I see the concern there. The main issue I have with the process is that I'm not sure that it's appropriate for a local board of health to be reviewing, technical health studies and then acting on it without getting input from, let's say, more authoritative sources like the State Department of Public Health or the federal CDC, Centers for Disease Control. It just, I rely on the expertise, since we belong to the Alliance, the expertise of the City of Worcester and the State Department of Public Health. And, I haven't seen any input in this regard from those entities. So that's my first take, as well as looking at the studies. There are still some uncertainties related to that prevent me from wanting to do something like this in the first place. Any further discussion?
And I would share your concerns. Probably one option is to have some of this material sent over to the Worcester Alliance or the State Department of Public Health for their input. Maybe one way to address what you brought up, which I think is a very cogent point. And number two, I think many governmental agencies, including at the federal level, have not come out and endorsed all of the findings, probably because the literature has been relatively equivalent about it, and there has not been conclusive data one way or the other. So while the concern has been raised, and I think the studies do raise the same concern, but there has not been conclusive data to equivocally state that it is a risk. So at what point is the threshold to notify people? And that would be where I would defer to bigger minds as well. So I share your sentiments.
I am curious as to whether or not this has been presented to OB or pediatricians and gotten some feedback from professionals in that area.
I don't know.
So, good morning.
Good morning.
So I'm happy to, on the board's behalf, raise this concern with Mass DPH. And certainly, we have a medical director, Dr. Mike Hirsch, who is a pediatric trauma surgeon at UMass, but obviously looks into medical issues such as these and concerns. So I'm happy to liaise with him and see, who would be appropriate to speak with in this field with this expertise and bring some information back or whatever the board's pleasure is.
That would be good.
Okay.
Because, I'm reluctant to issue basically alerts to the town, based on reading a study or a few studies. There are a lot of health research studies out there that we could be alerting the public to, so which ones do we do that for? So I'm not aware of any other Board of Health that has done that kind of thing before. I don't know if you have, Karen.
Mostly any alerts that we would, want to alert the public to, we heed that from the Massachusetts Department of Public Health, or, certainly Triple E,
Right.
that we went through, hepatitis A. We typically will get notified by the epidemiology folks at Mass DPH if something rises to the concern level that they think the public should be made aware of. So that's usually when we get our cue, or if there's something particularly of interest on a local level that might be just very unique to us, we would also provide that information to the public. But to your point, there's a lot of studies about a lot of public health issues. I don't know how you pick which ones rise to the top that you start elevating it to the public's attention. But as far as I know, this, and again, I've been gone for 4 months, but I don't think in that time there's been any kind of statement like that made from a Board of Health about this particular issue, but just the big ones that we dealt with this year around, like I said, hepatitis A or triple E.
Yeah, I do think one of the challenges is the fact that there is only 2 studies right now
Right.
supporting this. And I do believe there was a professor at the Harvard School of Public Health that actually had reviewed the studies, felt that more research was definitely necessary, to be able to support making a statement about it.
And I think that was my take on it as well, that I think there's definitely a question raised, so merits further study. And probably the margin of effect is so small that may require large studies, which may come with associated funding challenges, et cetera, which may be why there's hesitation or there has been some delay in doing further studies, but your points are well taken. So I think, yes, I would also look for more guidance as to what's a threshold for notifying the public when we have data which might be equivocal.
So at
Some
this,
guidance from the Mass Department of Public Health, as Karen has offered, would be a great way to continue to keep this on our radar.
Yeah.
yeah, so at this point, I'm hearing that we're still seeking additional information, especially from authoritative sources like the state, possibly the federal government, and at this point in time, will not ask for a vote on a motion because we still need more information.
Correct. We can defer.
Is that okay?
Yes.
Yep.
Okay. Okay, the next item is to review and discuss wireless technology in public health. Again, this is a similar issue where we have technical health studies conducted on this issue, and it is very, I think, a complicated issue. From reading the studies that have been provided and looking at the presentations that have been made, I think there's still enough unknowns in there for me personally to not pursue, let's say, addressing the Shrewsbury School Committee on an issue like this at this point in time. So I think that there's still too many unknowns. And again, it goes to the issue of a local Board of Health reviewing a technical studies and acting on them, which I think is problematic.
And I share your concerns, Mr. Chair. So Mr. Moss was very kind enough to provide us additional data, including the NTP study, and reviewed that. And actually, it brought down my level of enthusiasm even more because the study is even more equivocal or ambivalent to almost to the point of where they say that major limitations preclude an interpretation of any sort. So at this point in time, given the widespread prevalent use of cell phones in general, I'm not aware that a cell phone tower per se, there has been any data that supports a cell phone tower per se adding any additional risk more than the prevalent use of just cell phones alone. So I am extremely ambivalent about issuing any sort of recommendation because I think the data is marginal at best. So I share your concerns for the same reasons.
I would have to agree. I think that because of the research that's out there that contradict one another, it would be very difficult to be able to present a strong case to the school board.
Right. Okay, so I guess at this point then, we're still looking for additional information, and there's
Yes.
no action to be taken at this point in time. Is that what the board is saying?
Yes.
Agreed.
Yes, agreed.
Okay, thank you. Okay, the next item is to review and act on the report from the Central Massachusetts Regional Public Health Alliance.
So, rather than read this verbatim, just kind of pull out some highlighted pieces. I think the most, pressing, if you will, or of most significance is just what's been going on with the new tobacco legislation, which is a little bit confusing. We have been working with Mass DPH Tobacco Control Program to just really get very clear on who can sell flavors and who can't, and when does that happen. So we were able to craft a letter along with a chart that Mass DPH provided. It's essentially a grid to figure out if you're this kind of a store, can you sell this kind of a product? Because the landscape of tobacco has just changed incredibly, and it's not just, the Cumberland Farms of the world. We have, adult-only stores, tobacconists, head shops, et cetera, more obviously in Worcester than here in Shrewsbury. But we worked with Kerry to craft a letter to the retailers, just really trying to be very systematic about explaining all of these things and when they're going to go into effect. And so Joshin Nurola, who's our tobacco control expert, is going to be working with all the retailers in the alliance just to make sure that, sending a letter is one thing, but physically going in to just make sure that everybody's on the same page. So she'll be doing that over the next several months. So I think that's, for me, sort of the big ticket item, and all of these issues around vaping and, teen use and the epidemic there. So I'm very happy and surprised at the same time, but more happy that the state took such bold action around this, because, in the past year or two, we've had many conversations about this and trying to strengthen our local regulations, and obviously sort of keep going back to that same apple to take another bite, and not to be able to do it always in a comprehensive way, because we really were getting our data and sort of, framework from the state. And so I think having a really comprehensive law around this will help us really strengthen this on the local level, which is what we've been trying to do for a long time. So I'm just grateful for them to take these bold steps. I think it's really going to help with the epidemic, especially with the kids, because of all these flavors. So we're just trying to, make sure that we're on the ball with everything that's happening around tobacco. And, obviously you can see that, everybody on the team, in particular community health, they're always out there, working with the different coalitions that we have. There's one here in Shrewsbury that our staff supports. And, they're just, I'm always amazed at how much they're able to do. And even these two pictures here that are on sort of this third page, the Grafton Coalition for Healthy Grafton did a sticker shock campaign. I don't know if you've ever heard of that, but this is something that we want to work with, the community in each alliance town and the police department. It's basically working with liquor stores to go in and actually have some of the teens put stickers on saying, thank you for not, purchasing this and handing it off to a minor. So they call it sticker shock. And obviously we're in flu season, so I know that, we're still encouraging people to get the flu shot. It's never too late. Most of the flu shots, I think people get either from their primary care or from the Walgreens of the world. It's funny how we've gone from being able to have hundreds of people lined up to get our flu shots to we can't even pay people to take them for the most part. But needless to say, there's still some communities in the Alliance that still like to have them for their staff, still like to have us sort of go in and try to promote this with different groups in their towns. So, yeah. And then I did hear, which is not on here, that I believe out in Western Mass, in the Springfield area, they're experiencing another hepatitis A uptick. So there's gonna be a call, I think, in the next week or so with the state, just to talk about the numbers and whatnot, because the last time this happened, it was really starting in the Boston area, amongst the homeless and substance use population. And then very quickly, there's a bit of, there's some people who are transient between sort of Springfield, Worcester, and Boston. We saw that very quickly and, spent 6 months on that. So just something to put on your radar, that we're just trying to get a handle on numbers, and is that starting to come towards the Worcester County way, so I'll keep you posted on that. Do you have any questions on anything in here?
Yeah, I think that covers it. I think the Shrewsbury flavored tobacco product ban, it may be in effect for maybe like 6 months in terms of the state taking over, the
Right.
state legislation taking over, so. But it's amazing what's happening.
It is, and I think it really helps us on the local level, because obviously it's a very political issue, and there's a lot of businesses that have tied up a lot of money in product. And, we've heard loud and clear that, this is financially, business model-wise, they're taking an impact. So I think, there's always that struggle between economics and public health, and, what is our role in that? And so, yeah, we'll continue to just work with the retailers to try to educate them. And then, Mr. Chairman, if I could, have you actually met Ivan and Danielle officially? Okay.
We-
All right,
we
just
did-
making
meeting.
sure,
We did
okay.
at the last meeting.
And
yes.
I didn't know if you wanted Ivan just to say a few words about how inspections are going, or any issues that you're encountering.
Yes, I've done 41 routine inspections so far, and I've had some concern with some restaurants that I've been going back for re-inspections. Some of the common violations that I've been observing were proper hand washings, temperatures issues. I've also been working with some operators to get them certified food certificate, certified food certificate, I'm sorry. And I also have been encountered some chemical storage, chemical labeling, how to store chemical properly, some restaurants. And as you can see on my report, there've been some corrective actions. Part of that was re-inspections, and some of the violations have been collected so far, and then some of them are in the process of being corrected. And so far, everything is going well, and I'm still going to work with the operators to make sure they're in compliance.
Wonderful. Thank you.
Yeah, speaking of restaurants and chemicals, has there been any fallout from the
I was thinking
Buffalo
that too.
Wild Wings incident? From what I understand, it was a mixture of sodium hypochlorite by itself is not that toxic, but I guess it mixed with another chemical that probably released the chlorine, but.
Yeah, I haven't seen anything in particular come through. I don't know, Danielle, if Phil shared anything. I didn't see anything, but and then I think it happened again at some other restaurant, like maybe a couple weeks
There
later.
was another, not as serious, but there was some other incident.
Right.
So I was wondering if the state is providing any additional training
No,
or
but
something.
I'll ask Phil about that, because that was on my radar too, especially since it happened again. Obviously, the first incident, someone passed away from that, which is tragic. But I do think that that's another tool in our toolkit when we're out and meeting with people in the restaurant industry, or people that are using chemicals to clean. What not to put together, or the amounts and so forth. So I'll just follow up with Phil and see if he has anything he can share that we can give out.
Any,
Let the record reflect, we are delighted to have Karen back with us.
Oh, thank you.
absolutely.
Thank you. I
She is a
appreciate that.
delight. That's one of her favorite sayings.
I am a constant delight, which is not true. And Mr. Chairman, I didn't know if Mrs. Stockwell I like that we have matching turtlenecks. That's fantastic. We didn't plan it. Did you have anything that you wanted to share with the board about how, anything that your trends or anything that,
Actually, well, being as this is like going into my ninth year of renewals, this is by far the best renewal season that we've ever had. Right now, I'm renewing 10 different categories, but in particular, food establishments. They've been so responsive. We're almost 100% renewed for January 1.
oh, that's great.
That's great.
So when I first came here, everything was mailed out, but over the years, collecting email addresses and getting key contact information has really helped facilitate the permitting process to be more streamlined and efficient. And they've come to expect to get an email from Kerry Stockwell. So I've been very appreciative of their responsiveness, and a lot of them actually come in at this time of year too. So it's kind of nice to see them physically as well and check in and see how things are going. So excellent with that.
Great.
Very good.
I just want to say, I actually like this summary report, Ivan. It's very helpful.
Thank you.
Great.
And I like how it's like red and green, you know, it's almost holiday-ish. I don't know if that was intended.
No, it wasn't.
It looks good.
Thank you.
By accident.
Festive. Yep.
And the polystyrene ban, of course, is coming into effect January 1.
Yes, thank you
Yeah.
for reminding us.
So we've been pushing out that information like for well over a year. We haven't had any pushback at all. And so when I go to physically mail out the permits, a hard copy of the brochure is accompanying that as well, just as a last, kind of put it out there, so.
We know Kerry's always on top of all of these things. It's
I
wonderful.
call it gentle nudging.
I call it friendly reminder. When I send emails out, you'll see that once in a while.
Yeah.
Okay, any other questions, concerns?
No?
Okay, I guess in that case, the last item is to review our meeting schedule. And if
I can't believe it's going to be 2020.
we
It's,
want to look
wow.
at January 2020.
Rethinking the 24th?
Friday the 24th seem okay?
Yeah, right now.
24th, or I had 17th, or the 24th, either one is fine with me.
Same here.
24th is fine.
Okay, so unless otherwise noted, let's plan on 24th. Is 8 o'clock still okay? Okay.
Okay.
Okay, so in that case, do I have a motion to adjourn?
So moved?
A second?
All in favor signify by saying aye.
Aye.
So adjourned.
Happy holidays,
you.
everybody.
Yes, happy holidays to you.
Christmas.
Merry
Wonderful.
Christmas.
Yes.
Yes.
Glad to see you.